We expect the government of Quebec to recognize the existence of systemic racism in its own public institutions.
5 years have passed since the death of Joyce Echaquan, the Atikamekw mother of 7 who died at a Quebec hospital in Joliette, north of Montreal, who, moments before she passed, live-streamed as hospital staff threw racist and derogatory remarks at her. Drafted by Atikamekw leaders after her death, Joyce's principle sets out recommendations to guarantee discrimination-free healthcare for Indigenous people, with the goal of enshrining it in Quebec law. But half a decade later, the organization behind it says progress has been inconsistent across the province.
Has there been improvements in healthcare delivery in Quebec? The answer is yes, but largely scattered, because these improvements depend entirely on healthcare professionals who are personally and as a team committed to advancing cultural safety.
The group adds that even what they call small legal steps, like Quebec's Bill 32, which was implemented after Echaquan's death and aims to guarantee Indigenous people medical care free of racism and bias, still fall short of their goals, since the law is up to the interpretation of the individual healthcare provider.
This means that hospitals, CIUS, will be deciding on their own whether their services are culturally safe, whether their services are free of racism.
They argue Quebec needs a centralized mandate that would notably require all nurses in the province to undergo training in culturally safe care, especially in cégeps. They add that it all starts with openly acknowledging systemic racism, something Premier François Legault has refused to do in the past.
So one of the key solutions here is training the future nurses so that they do not treat Indigenous people like Joyce Echaquan was treated.
City News reached out to Quebec's Ministry of Health and Ministry of Indigenous Services, who did not respond in time for our deadline. Organizers behind Joyce's principle say the government must also respect Indigenous self-determination in healthcare delivery, which would mean co-governing services, placing Indigenous leaders on hospital boards within their territories, while also ensuring concrete on-site measures like interpreters for people who don't speak French or English.
And Indigenous nations know the way to get there. We have Indigenous healthcare culturally safe frameworks to implement. We have methodologies. We're literally just waiting for an invitation to work with our allies.
In Montreal, Zachary Cheung, City News.